Yeah.
So in this video we will discuss two important bones of the upper limbs, which is the scapula and clavicle. We will first discuss the scapula. This scapula is basically the flat triangular bone. This is flat bone and triangular in shape, you can see that. The scapula forms the posterior part of the shoulder girdle and it lies at the back of the thorax superficial to the ribs. So if we discuss about its surfaces, it has two surfaces. This surface is the posterior surface and this is called the interior surface. This interior surface is slightly rough and it lies over the ribs, and this is called subscapular fossa. This is the posterior surface and this is the interior surface. Posterior surface is a place where the muscles attach, and this is slightly smooth in nature. So these are the two surfaces, posterior and interior. If we talk about its border, it has basically three borders. This is called the lateral border. This is the medial border, and this border lies close to the vertebral column, and this is the superior border. Here above this lateral border you can see this cup-shaped cavity. This is called glenoid cavity, also called glenoid fossa, where the head of the humor articulates and form ball and socket joint. Slightly above this glenoid cavity there is a tubercle which is called supraglenoid tubercle, and slightly below this glenoid cavity there is another tubercle which is called infraglenoid tubercle. So above this lateral border we have discussed this circular shaped glenoid cavity, also called glenoid fossa, where the head of the humor will articulate and will form ball and socket joint. So these were the three borders: lateral border, its medial border, and a superior border. If we talk about angles, it has three angles. This is called the inferior angle, this is the lateral angle, and this is the superior angle. Here you can see a process over this posterior surface of the scapula, and this process is called the spine of the scapula. And the portion of the scapula which lies above the spine, this is called supraspinous fossa, and the portion of the scapula which lies below the spine is known as infraspinous fossa. At the end of the spine you can see this tuberosity. This is known as acromion process. This acromion process will articulate with the clavicle and will form acromioclavicular joint. Above this glenoid cavity we have another structure which is similar to the beak of a crow, and this is called cricoid process. This is called cricoid process. So this was about the scapula. Now we will discuss the clavicle. This clavicle or a collarbone is a long and a curved bone which forms the interior part of our shoulder girdle. It has two borders. This is called the medial border and this is the lateral border. And if we talk about its curves, it has two curves: concave curve, this is concave, and a convex curve. This medial border over here, it will articulate with the manubrium of the sternum and will form sternoclavicular joint. And here on this lateral border, this lateral surface will articulate with the acromion process of the scapula and will form acromioclavicular joint. This concave portion will form 1/3 part of the curve of the rib. This 1/3 curve is concave in nature, whereas this 2/3 curve part is convex in nature. So this rib has basically two curves. This is concave, this is, here you can see concave, and this is convex. This was the superior surface of clavicle and this is the inferior surface of the clavicle. Here you can see a tuberosity, a tubercle over this inferior surface, and this is called our coaster tubercle. This is called coaster tubercle. Slightly near this coaster tubercle there is a groove over here, and this is called subclavicular groove. Below this cricoid process there is this line which is known as trapezoid line, where trapezius muscles articulate. So we have discussed this clavicle, which is also known as collarbone. We have discussed its two border, its medial border and its lateral border. Then we have discussed its surfaces, its superior surface and an inferior surface. We have also discussed its curve, its concave curve and a convex curve. Inferior surface we have discussed three structured. One structure is this tuberosity over here, which is known as costal tubercle, and then we have discussed this subclavicular groove over here, and below this cricoid process we have discussed this trapezoid line where trapezius muscles articulate.
I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this,